Hello everyone, my name is Dr. Amit Chakraborty. I am a head and neck cancer specialist from Specialty Surgical Oncology, Mumbai. Today in this video, we are going to discuss about the recovery process in head and neck cancer, especially after the surgery. So what we have seen, the early you come for the treatment, the better is for yourself, means for the patient and for the family members. How? We are going to see it now. Basically, if the surgery is being performed at an early stage, then you require minimal amount of resection and minimal amount of reconstruction. That means you're back to the normal life at the earliest. Basically, if the surgery is being performed at an early stage, then you require, we tend to keep the nose feeding pipe hardly for 3 to 5 days, not more than that. After that, you're being able to take the things orally, completely, and you can go back to your work as you were doing prior to surgery. But more late you come into the picture or visit your cancer specialist at a later stage, then your treatment is much more complex. Part of your body gets removed and we do a lot of plastic reconstruction either for your jawbone, tongue, cheek, based on the different sites that has been resected. In that duration, you need to keep your Ryle's tube feeding, that is your nose pipe, minimum for 2 to 3 weeks. During that duration, you don't have any oral feeding, only feeding through your nose pipe. Then gradually we overlap your oral feeding with Ryle's tube feeding for 1 week. Once we see that you are comfortable with the oral feed, then we remove your nose pipe. That is tentatively after 1 month. So you have to take care of yourself through this particular feeding for 1 month duration minimum if you are late into the procedure. Secondly, a lot of patients have stiffness in their neck after surgery. It is because they don't do their shoulder and neck exercises after the surgery. You have to perform minimum 100 times a day the surgery for both of your shoulder and neck. This will help in reducing the stiffness of your shoulder and neck. Third, you need to do good dental rehabilitation after the surgery. If a free fibula flap has been done, where we resect the bone and replace the bone, then we can implant the teeth as early as 6 months after the surgery if no radiation, and as late as 2 months after the surgery if the radiation is there. So what is most important? The entire treatment journey depends when you have reached for the treatment. Early you have reached, you have a good treatment. At the late you have reached, you have a more complex treatment. And for thyroid and parotid cancer, again surgery is the gold standard treatment. In thyroid, we always preserve recurrent laryngeal nerve. So the chances of hoarseness of voice is very, very minimal. We preserve minimum 2 to 3 parathyroid glands. So the chance of having hypocalcemia is very low. And in parotid surgeries, we preserve facial nerve. So the chances of having facial neuropraxia, facial paralysis is reduced significantly. So any treatment in head and neck cancer definitely has got some recovery time, but that time always depends on the stage of your presentation. So do get yourself treated early. If you have patients, those who are having head and neck cancer, you can bring down to me. You have the number on the screen where you can book my appointment. If you have questions pertaining to head and neck cancer, you can subscribe my YouTube channel and get yourself educated. Thank you.